How are you? Welcome back for Health, Wellness, and Lifestyle.
Thanks, Fay. Always a pleasure. I'm sure we'll have another fun time today.
And I'm hoping your dog might make a guest appearance. You loved him last time.
He's sleeping right now on the other side of the apartment. I mean, the first time he's left me alone in like 3 weeks. So,
I'm sure, I'm sure, I'm sure we'll share in that sentiment. So I have to tell you, the feedback from our last session when we met has been fantastic. I mean, just having someone give us real life what's going on out there, uh, and what we can do in here is fantastic. So last time we focused what we could do starting even here at home. Uh, what I'd like to do is maybe like a reality check. What's going on?
yeah, well, I think, it's really important to have those because this whatever we're going through is changing so quickly at all times. And the facts that you report on a week ago are completely different than the facts we're going to talk about now. But it was really interesting yesterday or, just this week, just seeing a vast difference between the week before and the week before that. And it's just been an incredible difference in sort of what's on the front line. So while I may not work in a hospital full time, yesterday I was at Mount Sinai, and which is a huge hospital doing lots of antibody testing and all sorts of things like that. And I was a little trepidatious. I was afraid to go actually. And but I went. Like, it actually woke me up in the night before, and like I tossed and turned for half an hour about it. Maybe I won't go. I should cancel. But anyway, I went, and I found it to be an incredibly amazing and uplifting experience. And it was sort of like everyone was calm, everyone was doing their job, everyone was sort of, everybody was following the rules, doing what needed to be done. And there's a couple points with that. One is it wasn't crazy. It wasn't, all these nightmare stories, all this horrible stories that you're hearing out there. There was nobody dying on the corner, on the street corner of the hospital. People were getting in, everybody's filing in orderly, everybody's having their hands washed, their temperature taken. This is sort of what life is going to be like for a little while. Probably at least all summer, where we're going to have.
But if I might interrupt, I mean, from what we've been feeding into the frenzy, exactly what you just described, we thought was going to be what we would see. I know it's the new reality, but it's nice to hear that it's doable.
It's not only doable, it's calming. It's really kind of refreshing. It's sort of like I felt like we were at like a level 15, and now we're at least at a level 9 maybe. There's some sort of, people are getting into the flow of how life works like this. When you're at a hospital, and I've worked in hospitals for many years, when you're inundated like that, all you have time to do is react. And I speak to all of my colleagues who are my age. And, we know what it's like to have been through another epidemic before. So it's sort of like, this is how it is. And yes, there's going to be gurneys in the streets, and there's going to be gurneys in every hall. But, this too, we'll get through it. And we'll figure it out as we go along. And it's been really, and even I've spoken to younger colleagues who are really on the front lines, and they're also experiencing a severe drop in hospitalizations and how many people are coming in that's super sick and all of that. So while I don't want to paint a rosy picture, I do want to give a little bit of reality check here that it is doable, and that we are doing it all. And, we are accomplishing what we need to accomplish right now. Congratulations to everyone who's participated in that and is doing that. But on the other hand, the other focus is something that has been sort of troubling me, is that people are not taking care of themselves routinely. For a while, we up until yesterday, actually, weren't able to have elective procedures. But just because you can't have your cataract surgery done does not mean you shouldn't be having blood pressure checks, and you shouldn't be, getting your EKGs done. And, if you have a sore throat, talking to your ENT doctor. We're all here to help you, whether it's through telemedicine, I was in my office all day yesterday. It was amazing. It was like, I had my life back. Like, I went to the hospital, and I saw patients at my office. I was like, wow, this is what I did. It was like real life again.
Which is fantastic. I mean, I'm sorry to interrupt, but this is what people want to know. is there some semblance of normalcy, of a life? Also, where it's not like, okay, I had this going on, but because of what's going on with COVID, I'm not going to pay attention to it. If you have an underlying problem, continue, take care. Don't stop taking care of yourself.
No, no, don't stop taking care of yourself, and don't stop taking care of your routine checks. Like if you need if it's mammography time, if it's colonoscopies just started yesterday, but you have to get yourself on the schedule. Imagine what's going to happen once it's all released. All these 6 weeks, 8 weeks, 2 months, 3 months of people backed up who haven't had procedures done are all going to want to be rushing in. So I really think, and a lot of my patients, at least the ones I saw yesterday, and the ones I've been speaking to, the absolute level of fear has calmed down, and people are like, now what do I do? Like now it's time. Like I need to get back in shape. I need to get back, on my routine. Like I want my blood test taken. I want to make sure I'm not, I'm getting rid of all the sugar in my apartment. I'm getting back on board because there is more to life than this virus, and we can't not take care of ourselves no matter what's going on. And whether you're afraid to go out, doctors are doing telemedicine. You can call your doctor on the phone. You could have visits on your phone. Don't neglect your health in any way, shape, or form. Don't be afraid to not get your medications if you need your medications. Don't be afraid to not get your nutritional supplements if you need them. Be diligent about being online, looking for the good food, and don't just accept. I'll give you this example. So I put in an order for one of those online food things. And so the shopper starts shopping, and I had ordered okra because it was the only frozen vegetable they had to option, right? So I'm like, okay, I'll take okra. I like okra. I'm one of the weirdos that like okra.
I'm Greek and I love okra, so it's perfect.
So I'm like, nobody else likes okra, so I'll be sure to get it. So the first thing on my list, they're like, well, it's not available. And then they're like, here's a substitution. And it was a loaf of sliced bread. I'm like, that's not even in the same category. One's a vegetable, one is poison. So like, how could you possibly make that substitution?
There's no connection at all. Like
At all, not a vegetable. Like you could have offered me another vegetable. So I'm just like, no thanks.
Even if you're shopping online, you have to be careful and pay attention. What are you getting? What are you bringing home? What are you doing? You hit it right on the nose today. Routine. I'm off of my routine, and I'm craving to get back on my routine. It's just sometimes I don't even know how. I'm overdue now, way overdue for my own health and wellness, like check-in visit. So I'm like, oh, I'm going to put it off.
Yeah, well, don't. You don't have to. I mean, you don't have to. And I don't want to be self-serving about this, but you have to realize that doctors' offices are also struggling. They're not getting they were the last ones. We're some of the last people to get the paycheck protection programs because all the bigger companies swooped in and got it before we did. We're having to lay off people because nobody's coming into the office and we don't have staff. So it would kind of be, we want you to not only engage in your health, but support us in some way as well. As like, we want you to stay well because, I had a patient yesterday from Phoenix. And she was diagnosed with breast cancer. And her doctor will not do the surgery on her because they considered it an elective procedure. I'm like, cancer is not an elective procedure. Like, you're not having your breasts augmented or decreased. You are having a lump removed because it's cancer. They're telling you, probably won't be till July or August. I'm like, that's nuts.
But
that's a little crazy.
That's terrifying. But again, getting on your routine, maintaining your routine is crucial because of situations like that, because for detection. It's almost like, and I've been doing the Grab and Go Snack campaign. I've been doing whatever I could to fuel the front lines. But there's another front line we really have to focus on as well at the same time, like simultaneously, is ourselves individually and our doctors who we need there to help us individually.
Yeah, and the thing is, we do need, and what I've been seeing not only on my online stuff, but also my regular patient population, they're like, yeah, let's get back to business. Like, let's take care of the diabetes. Let's take care of heart disease. Let's do prevention, and I think this is really beautiful. It's a beautiful time to sort of look at yourself and say, what can I do to make myself healthy so that should anything ever come out like this again, or just anything in general,
Correct.
how can I be healthy? How can I maintain my immune system? How can I just be the healthiest person I can be so that when anything comes along, the flu, this craziness, whatever happens to come along, even just, you have to realize whatever, even if it's heart disease, if you're eating right or exercising, your risk for heart disease and diabetes goes down dramatically. So like, why wouldn't you want to be incorporating that into your life? Like, yes, exercise can sometimes, go away because we're out of our routine, right? But so we may have to look for a new routine, or at least, I always try people, look, every day is a different day. So even if it's, I'm not going to have the same 5 minutes to do my exercise, might not be at 3:05, but it can be at 4:05 or 4:15, just get it in there somehow.
Adjust your timeline. You want to stick to a routine, and it's okay is what you're telling me today, which is nice to hear, that it's okay to adjust your timeline as long as you try to get back to a routine, establish a routine, whether it's going to be a new routine, right? Like I'm going through a mental checklist of exactly what you're saying, because even like our last session, when I opened up about my own secret, I was divulging in what I thought was a healthy snack of popcorn. I shifted. I started having more like a strawberry, like, more like fruit, more antioxidant. They sell freeze dried strawberries that my kids love. It's much better than trying to make whatever Duncan Hines or whatever else. It kind of helped.
Sure.
I ordered a huge case of it, and my kids are going through it. So I'm like, okay, score one for mom. I'm bringing like healthy back in, But another thing is that I'm concerned with, I'm hearing from people, because, we're having conversations, we're talking, they're thinking once this vaccine comes out, I'm good, or they're waiting to depend on that. And that scares me.
It really scares me too, because I think people are putting all of their eggs in one basket. And so, and they're getting all this expectation up for, oh, here's the magic bullet that's going to cure everything. Well, I hate to say it, but there's never been a virus on Earth that we can tackle with a vaccine. We just haven't come across one yet that's vaccinable. So when you look at uh, even the flu vaccine is 10 to 30% effective at best,
I know.
given whatever year it happens to be. You know
Right.
what I mean? So we can't expect all of a sudden there's going to be a vaccine and it's going to be affect 100% of the people. We don't have a vaccine yet for a virus that does that. So especially a respiratory virus. So don't get your expectations too high about that. While it may be able to decrease the susceptibility of older people, immunocompromised people, the laundry list of people who have pre-existing conditions, which let's get back to pre-existing conditions, please.
Yeah.
Because I'll go off on some tangent, but remind me to get back there. Is that it's not going to be the magic bullet. It may help, but if we're looking at 12 to 18 months for that, we can't live our lives like this for 12 or 18 months.
No.
We can't live in this unhealthy situation, both physically and emotionally, mentally. We can't have children sit at home and be locked up as prisoners forever.
Yeah.
So at some point, we have to just learn to manage our expectations a little bit differently. There is no magic pill. Maybe there'll be a magic pill. There was for HIV, but it took years before we got that magic pill for HIV.
Shut down completely again. This is like crazy. We can't keep doing this until we come up with that magic vaccine. That can't be the only solution.
It's not it's not the solution, because we've never been able to do that for viruses. You know what I mean? And it's sort of like, you have to think about it. Viruses, especially respiratory viruses, they come into the community, and as more and more people get it, it becomes less deadly, because as it multiplies and mutates and changes, that's the natural course of respiratory viruses, is that they get less and less and less. The original SARS virus, because this is a SARS virus, the original SARS virus was 10% deadly. It killed 10% of the people that it came in contact with. The old SARS virus is now 95% less deadly than it was when
Wow.
it first came on the scene a decade ago. You know what I mean? So viruses, just by their very nature, do that.